So when it comes to this whole low carb, high fat way of eating, it all comes back to insulin, or at least the majority of what we're talking about comes back to insulin. So taking that even a step further, what are your thoughts on fasting or intermittent fasting, time restricted eating, where we're actually taking food right out of the equation? Is that part of what you do, to maintain your health and well-being?
Yeah, and I discuss this in the book, but I'll tell you a story about this. 2 years ago, there was a meeting in Zurich that was co-hosted by the British Medical Journal and a company called Swiss Re. Swiss Re is a reinsurance company, the biggest in the world, and I didn't know such companies exist, but reinsurance companies insure insurance companies. So they make money when people stay healthy. They don't have to pay out to the insurance company. So they have a vested interest in keeping people healthy. And the British Medical Journal and Swiss Re have both become open-minded sort of allies to the arguments we've been making. So they have this conference, and the Saturday part of the meeting is obesity, nutrition, chronic disease researchers from around the world discussing, sort of arguing on some level about, establishment figures discussing this and arguing as much as they will with people like me. And then on Sunday, they had a special meeting on type 2 diabetes that was only the sort of low-carb world. And they were big. This is at this beautiful conference center Swiss Re runs outside of Zurich, and there's 50 of us sitting around this huge round table. And I asked as a test how many of these 50, and these are the sort of leading influential physicians and journalists in the low-carb world, how many were doing intermittent fasting / time-restricted eating, and 45 of the 50, including myself, raised our hands. So I did it as an experiment. Just like I tried Atkins as an experiment, I thought everybody's talking about intermittent fasting. It was kind of pioneered by Dr. Jason Fung in Toronto, and I respect Jason. And so it's about 4 years ago now, I was giving a talk in San Diego, and then another talk in LA, and I was basically traveling for 3 days. And so if I wanted to stop eating breakfast, and so fast from after dinner around 8 o'clock at night till my lunchtime at 1 o'clock the next day, all I had to do was stop eating airplane food, which is relatively easy. At home, I cook breakfast, make breakfast for my family, so it's hard for me not to eat freshly cooked eggs or bacon, but I could skip airplane food. So after 3 days, I didn't miss it. I had more energy. My head was clearer in the mornings. I wasn't hungry. And over the course of 5 months, I lost about 12 pounds I didn't think I had to lose. I was happy with my weight, but then I got 5 pounds thinner. So my belief is, so first of all, intermittent fasting and time-restricted feeding, to me, are kind of the flip side of the same coin. Like I say that I fast from 8 o'clock to 1 in the afternoon, which is 17 hours or 15 hours, no, 17 hours without food. So that to me, I'm doing intermittent fasting, but I could also say that I only eat between 1 and 8. So that's 7 hours with food. That's time restricted eating. I restrict it to a 7-hour window. It gets a little more subtle than that. There are different ways to do intermittent fasting and different ways. But my thinking is, going back to Yellow and Burson, if you want to get fat out of your fat tissue, your fat has to see the negative signal of insulin deficiency. And by compressing the time you're eating or lengthening the time you're not eating, you lengthen the amount of time during the day that your fat is seeing that negative signal. So you lengthen the amount of time that your fat is mobilizing fat and using it for fuel. Because as soon as you start eating, you're going to secrete some insulin, even just a little insulin on a ketogenic diet. So I rarely talk to anyone anymore on low-carb diets who do not also intermittently fast. And what's interesting, just to throw this in, again, my next book will be about diabetes. So I've been buried in the diabetes literature going back to the 18th century. And intermittent fasting, the term was used 120 years ago to mean skipping eating on an entire day, usually. And it was considered the sort of vitally important adjunct to dietary therapy for diabetes. And you basically give the pancreas a day off every week, and it functions better. So the science behind it is not that well developed. But again, it's a very easy thing for people to test, to try, experiment with. And like I did it as an experiment, I stayed with it because I liked it. I felt better. And I don't miss it. I don't miss breakfast. You can experiment. Then for people who are nervous about eating all the saturated fat or the animal products that comes with the ketogenic or low-carb, high-fat diet, not eating for a day doesn't come with any of that baggage.